Welcome to my YouTube channel. Today we are going to talk about classification of hypertensive disorders in pregnancy. Kindly make sure you subscribe. Let's dig in. Classification of hypertension. So the hypertensive disorders, we classify them according to their gestation age. So when did this hypertension start? If the hypertension was less than 20 weeks of gestation, then we define that as chronic hypertension. Chronic hypertension is when the patient had already pre-existing hypertension before gestation. And then if it's greater than 20 weeks, then we can define it as preeclampsia, gestational hypertension, chronic hypertension with superimposed preeclampsia. So now on details and definition, and let's recap what we said in the previous slide. And we said we can define the classification of hypertension as into two, depending on the gestation age. If it is less than 20 weeks, then that is chronic hypertension. If it's greater than 20 weeks, then we can have preeclampsia, we can have gestational hypertension, and we can have chronic hypertension with superimposed preeclampsia. So now let's look now at the definition. So preeclampsia, I think we should start with chronic hypertension. So chronic hypertension is any hypertension that predates pregnancy, and we say that we can define it when it is less than 20 weeks. The next one, let's go to preeclampsia. Preeclampsia is when you have elevated BP after 20 weeks, as we said, of gestation. And this BP is usually associated either with two things, that is proteinuria or any of the severe features of preeclampsia, which are going to look in the few slides. Then we go to gestational hypertension, which we defined it as BP elevated greater than 20 weeks of gestation age. However, in this BP which is elevated, you have absence of proteinuria or any of the severe features of preeclampsia. And then the third one, which you said is chronic hypertension, which you superimpose preeclampsia, which is chronic hypertension, but we have association with preeclampsia. And what did we define preeclampsia is? We define this is when you have 20 weeks obvious, greater than 20 weeks, and it has to have two features, that is proteinuria, and it has to have severe features of preeclampsia. So in these few slides, we are going to dig in on more of the definitions. And just to recap what already we know, we said chronic hypertension is when you have hypertension that occurs before 20 weeks. And we say this is when you have hypertension that predates pregnancy, or hypertension that was already there before pregnancy. So let's look now on the definitions or the criteria. Kindly note is any of the following. So this is hypertension before pregnancy, as we already said, and this is development of hypertension during pregnancy before 20 weeks of gestation. And then here we have a third definition or a third criteria, where we have development of hypertension during pregnancy after 20 weeks. However, this hypertension has to persist beyond 12 weeks postpartum. And then what are the causes of chronic hypertension? We go back to our IMED class, where we said chronic hypertension causes are divided into two, that is essential hypertension and secondary hypertension. So preeclampsia, what is already our pre-existing knowledge, we said preeclampsia can be defined when you have hypertension greater than 20 weeks and you must have proteinuria or severe features of preeclampsia. So now let's dig in on the definition. So the criteria is all of the following, where you have development of hypertension during pregnancy after 20 weeks of gestation, and development of new onset proteinuria, that is 0.3 grams per 24 hours unit collection during pregnancy after 20 weeks of gestation, or severe features of preeclampsia. So what are the subtypes of preeclampsia? Where you have mild preeclampsia and severe preeclampsia. So typically what this means is mild preeclampsia is where you have preeclampsia without severe features, and severe preeclampsia is where you have preeclampsia with severe features. You can also have a subtype which is HELP syndrome, and this is hemolysis, elevated liver enzyme, and low platelets. You're going to look on this in the next slides. So eclampsia, which is kind of falls under preeclampsia, and for you to define eclampsia, all the following have to be present. So number one, all criteria for preeclampsia must be met. What did we say are the criteria for preeclampsia? We say the criteria for preeclampsia, the patient must present greater than 20 weeks, and you must have proteinuria or severe features of preeclampsia. So that plus presence of general tonic-clonic seizures, which cannot be attributed to any other causes. How did you define gestational hypertension or transient hypertension? We said gestational hypertension, the patient has to come in greater than 20 weeks and the patient does not have proteinuria or severe features of preeclampsia. So for you to meet or to define a patient to have gestational hypertension, all the following criteria has to be met. And this is development of hypertension during or after 20 weeks of gestation, and there is no development of proteinuria or severe features of preeclampsia, and the resolution of hypertension by 12 weeks of postpartum. What do you define hypertension that occurs 20 weeks of gestation, and however you don't have resolution of the hypertension 12 week postpartum? We define that as chronic hypertension. So the last one, which is superimposed chronic hypertension with superimposed preeclampsia, any of the following can be the definition. So non-hypertension before pregnancy. So I already know I only have hypertension before pregnancy with development of proteinuria, that is 0.3 grams per 24 hours during collection during pregnancy, or non-hypertension and proteinuria during pregnancy with significant increase in the blood pressure or the proteinuria during pregnancy. However, this is not a definitive diagnosis per se and need to be evaluated. Hypertensive disorders in pregnancy can be classified, again, this is just a repetition and just to recap what we have talked about, can be classified into two by gestational age, so less than 20 weeks of gestation, which is said is chronic hypertension, and we defined it with three definitions, which we say this is hypertension that predates gestation or predates pregnancy, or this is non-hypertension before pregnancy. And we also defined chronic hypertension as hypertension that occurs less than 20 weeks of gestation. In addition to that, we also defined chronic hypertension as hypertension that occurs 20 weeks after 20 weeks of gestation and continues 12 weeks postpartum. Then 20 weeks, greater than 20 weeks of gestation, we have preeclampsia, which is defined, it is when hypertension occurs greater than 20 weeks of gestation and is accompanied by proteinuria or severe features of preeclampsia. We also defined eclampsia, and eclampsia by definition, this is when you have all criteria of preeclampsia have been met, in addition to general tonic-clonic seizures that are not attributable to any other causes. Gestational hypertension, this is when you have hypertension developing, this is when you have development of hypertension greater than 20 weeks of gestation. However, you don't have proteinuria and you don't have severe features of hypertension. Chronic hypertension with superimposed preeclampsia, the definition of this can be when you already have pre-existing chronic hypertension. However, in pregnancy, you have new onset development of proteinuria that has new onset in pregnancy, or a patient who had already had hypertension and had already had proteinuria, but during this pregnancy, the